I'm guessing you must be sick of getting it in the neck from members of the public saying just can't get to see you for a sit-down, face-to-face appointment. Why are the reasons why it's still so difficult to see a GP in the flesh?
It's a pleasure to be with you, Colin. So the reasons why it's difficult to see GP in the flesh is because there's new constraints on the NHS, which all of us know about over the last 2 years. And dealing with those problems is about looking at the priorities. And first of all, it comes down to safety of the patients and safety of the staff. And these constraints are very important. So we need to prioritize. Other reasons of why it's hard to see a GP is because the population of the UK is changing. It's an aging population, which means people and patients are going to be more demanding of the services. And we have a lot of frequent attenders that are going to see the GP more than 5 times more than everyone else. This means that some patients are a lot more demanding. So the situation is changing. So we need to deal with it differently.
Doctor, a lot of I hear what you're saying, but a lot of those things applied before. The heart sink patients, as I think GPs call them, your heart sinks when they walk through the door because actually they take up a disproportionate amount of GPs' times and often don't have anything that can be cured there and then. We know the pressure that GP surgeries are under. That was there before the COVID pandemic. But it will strike some people that maybe sometimes it's just become easier to see people on a video call rather than in the flesh. And there's some inertia that's crept into the system because of that.
So I understand where you're coming from, Colin, but it's important to look at what's needed to solve the problem. It's about the outcome to help the patient solve the problem. It's not just because people want a face-to-face appointment. It doesn't necessarily mean that they need a face-to-face appointment. And it's for the medical professionals that know what the outcome and how to get the outcome that they need for the patient and to form the strategy. For example, I think a good analogy is in A&E, a lot of people will shout at the top of their lungs to get an appointment to see the doctor straight away, but they don't necessarily need it. It's not going to harm them. It's not going to be detrimental if they wait a number of hours. So, and also another very important point to mention is the media are sometimes not helping the situation that the NHS and GPs are facing. There's been a lot of accusatory, inflammatory language used, which can encourage people to complain. And sometimes these complaints are not really valid.